So to get us started, let's take a look at the Faculty of Health and Medical Sciences in more detail, including looking at some of the facilities you'll be studying in and where our degree offerings are positioned globally. So now that you know a little bit more about our faculty as a whole, let's put the spotlight on the Adelaide Dental School. Adelaide Dental School's reputation for outstanding teaching, contribution to community and quality of graduates has been built over a proud 100-year history, having recently celebrated its centenary. The Adelaide Dental School is currently ranked #1 in Australia and number 34 in the world, being the only Australian dental school ranked in the top 50 internationally. Our Adelaide Dental Simulation Clinic is located on the university's main campus, and it's here that students have the opportunity to practice real-world patient care procedures in a technologically advanced environment. The state-of-the-art workspace is where students develop their clinical skills using specialised equipment, including the 90 individual simulators that you can see on screen. Each simulator is equipped with its own mannequin, dental equipment and instruments, PC and monitor. Haptic technology provides students with immediate tactile feedback while performing different tasks. The clinic also includes 2 dental surgeries, a plaster laboratory, and perhaps the most extraordinary feature is the artificial teeth vending machine. The Adelaide Dental Hospital is an SA Health facility located on levels 11 and 12 of this building. It provides specialist and general dental services to the community. Students from our Bachelor of Dental Surgery and Oral Health undertake placements in the Adelaide Dental Hospital, providing treatment to these clients under the supervision of qualified dentist and oral health therapists.
Dentistry at the University of Adelaide is a 5-year undergraduate degree, and when you complete the training, you'll be a qualified dentist in Australia. A lot of our lectures and our tutorials are here in the HMS, because it also happens to be where the Adelaide Dental Hospital is. That is where we spend a lot of our time learning our clinical skills. And then the sim clinic, you're mainly focusing on learning how to do and also learning how to do root canal treatment. This gives an opportunity for all the practical components of dentistry, but not on real people. You practice on plastic teeth, but you also practice on extracted teeth.
I think work in rural clinics is the most inspiring thing I've done in this degree. Getting to work with some of the patients that have such unique backstories and show real appreciation for the work you do really makes me feel like this was the right career choice. This degree can lead to many different career paths other than just being a dentist. There's opportunity for specialisation. You can also go into research, and there's always the opportunity for oral health promotion in communities, which is extremely valuable. I feel at the end of this year ready to step out and start working on my own and being a professional.
So now you've heard from some of our students, it's my pleasure to introduce Dean and Head of School, Professor Richard Logan, who will talk you through the Bachelor of Dental Surgery and the Bachelor of Oral Health.
Thanks, Brooke. Yeah, thank you for coming along today. Yes, first of all, I'd like to just talk a bit about the Bachelor of Dental Surgery. As you've heard, this is a 5-year full-time program, and it's the only site in South Australia that you can actually do dentistry. One of the things which distinguishes, dentistry from some other programs around the country is that we make sure that people have a clinical experience from first year, and we think that's fairly important because it's such a long program. You want to know what you're getting into fairly soon in the degree. So from first year, you get experience in the clinic. As you've heard, some of our clinics are based in this building, which is Australia's newest dental teaching hospital. And as a dentist, you learn to do the full range of dental treatments that are possible, from complex restorative treatment through to preventative treatments. There's an element of surgery. So it's a diverse career, and you get to do a lot of different things. As you've seen in the little video beforehand, we start with our students working within the dental simulation clinic to learn some of those technical things that you need to do before you actually start working with patients. And also a large part of the program is working in teams and with your colleagues, with academic staff, looking at real life case scenarios so that you're able to sort of apply the things you've learned in the course to some real life scenarios which are similar to what you might be doing in the clinical situation. A large part of the program is treating patients and doing dentistry, and so there's extensive placements which occur not only in this building but across the metropolitan area and also rural settings. So our students go to Whyalla, Berry in the Riverland, Port Lincoln and Mount Gambier down the southeast. There's also opportunities for our students to work interstate as well and some interstate placements. So having such a diverse placement experience gives you a very diverse clinical experience as well, because each site is slightly different. One of the areas that our students really enjoy is the community outreach program. We run our own clinic in the city where patients come along who maybe can't access the South Australian Dental Service clinics or maybe can't access private dental clinics and get their dental care provided in that setting. So the degree over 5 years is a quite diverse and interesting one. So just a bit more detail about the 5 years. First year, as I said, there is some clinical experience that you get to do as a first year student, and a lot of that is just looking at the initial phases of patient care. A lot of that's working in small groups, and that might be things like just getting used to the dental environment, getting used to using a dental chair, some equipment, some instruments, doing examinations on each other, and just familiarising yourself with the clinical setting. In second year, a lot more emphasis is put on developing the technical things that you need to do fillings or which lead to sort of some of the more complex work you do in later years. And so in second year, you'll start to spend a lot more time in the simulation clinic to develop skills to examine, assessing patients' risk of disease, and managing patients generally with fairly minor conditions and relatively healthy mouths. In third and fourth year, that's when things get a bit more complicated and we start to see more complicated patients with more, not just complicated dental disease and oral health problems, but maybe more diverse medical problems, health problems, and get an understanding of how what happens in the mouth affects what happens in the rest of the body and vice versa. And you'll get to develop more clinical skills and see a lot more, or do a lot more in the clinic and actually start doing some more complex work with patients. The fifth year of the program is very much a clinical year. So the final year students spend a lot of time in clinics in the community setting, in this building, and also do some rural placements where there is a significant clinical load. And we expect our final year students, particularly by the time they get to the middle of final year, to be almost working as fully qualified dentists under supervision, but doing the full range of dental treatment that's available. So that's the 5 years in a nutshell. So in terms of career opportunities, we heard a little bit about that in the video. So once you finish the dental program, you get a professional qualification as a dentist, and you can register as a dentist with the Dental Board of Australia. A lot of our graduates go and work in private practice settings, but there's other options as well. So there are options within the government, within community clinics, within the school clinics, in the public sector. Some people go way off and do other things in developing countries and those sorts of things. But you also got to remember there's opportunities in academia. You can come and teach, you can get involved in research. And if there's an area of dentistry that you particularly like, there's the opportunity to do specialist training in things like orthodontics or root canal fillings or periodontics. There's a lot of options that you can go forward with the dental degree. The Bachelor of Oral Health is the other undergraduate program that we offer in the dental school. This has some similarities with dentistry, but also some important differences. It's a smaller group of students that that work through the oral health program, so there's a strong sort of sense of community within that program. Again, you get to work in the same state-of-the-art facilities that the dental students, the BDS students work in, so this building, the simulation clinic, and again, you do quite extended clinical placements in rural locations and also around the community clinics. So,
the Bachelor of Oral Health is part of the Adelaide Dental School, and it's spread over 3 years. So in first year, it's predominantly theory-based, and also we're in the simulation lab as well. In the second half of the year, we're lucky enough to see our first patient, which is a friend or family member, up at the Adelaide Dental Hospital, and so that introduces us to the clinic environment. In second year, we begin seeing our first real patients, so we're at clinic 2 days a week. In third year, it's very, very heavily clinic-based. And we also do some specialty training here at the Adelaide Dental Hospital.
I think one of the biggest factors about this degree is you actually get a lot of practice in a simulation clinic. So that entails basically working on a dummy where you work on fake teeth, you do all these procedures, you build up your dexterity, your skills, your knowledge, and you put it into practice so that you're confident enough to see patients as you progress through the degree.
One of the main aspects that I enjoy in this degree is the big change you can make in people's lives. It's great to personally see a patient and work with them over a period of time to improve their oral health, and they're super grateful, and it's a very rewarding career.
So the Bachelor of Oral Health is a 3-year full-time degree which leads to the qualification as an oral health therapist. Again, as I said, you in that program you get to work within this facility and the dental simulation clinic. Like the dental program, the BDS program, you have early clinical exposure and do some extensive placements in the city and rural locations. And basically get to do very similar things. I guess the difference between oral health and dentistry is the scope of dental treatment that you can do as an oral health therapist. You don't do the more complex crown and bridge restorative type procedures, or the things like adult endodontic treatment or root canal treatment. So the focus for oral health is really much more on prevention and promoting oral health for patients. But oral health therapists are an important part of the healthcare team. So over the 3 years of the program, in first year, it's very much an introduction to oral health and how that relates to things like anatomy, biology, and dental diseases, with a focus, as I said, on preventative management and developing some skills in the technical side of things in the dental simulation clinic. From second year, you start to treat patients in a variety of different dental clinics. So here in community clinics around Adelaide, and develop those clinical skills and skills sort of dealing with patients, and developing a deeper understanding of the biological, environmental and social aspects that impact on oral health. Third year, as in the dental program, this is the final year in the oral health therapy program. You spend a lot of time working in the clinics and actually providing treatment as an oral health therapist, while still sort of developing an increased understanding of dental diseases, and also involved in looking at the more population health level. So as an oral health therapist, once you finish your Bachelor of Oral Health program here, you can register with the Dental Board of Australia as an oral health therapist, which forms part of the dental team. You provide some general dental treatment with a real focus on prevention. You might be involved in developing educational campaigns to promote oral health. Again, you can work in a variety of different practice locations. So it might be private practices, government practices, but again, there's opportunities to work in academia and be involved in teaching and do research. I guess there's less opportunity for specialist training in the oral health therapy field as there might be for dentistry. I'm going to leave it there and hand it back to Brooke and take some questions in a bit.
So that's the what you'll be studying. Now we'll cover off how to get there. So we do have admissions guides which cover off this information, but at a glance, to be eligible for the Bachelor of Dental Surgery or Bachelor of Oral Health, you'll need to achieve the minimum relevant academic thresholds that are on the screen. Whilst these are a minimum, entry into both degrees is a competitive process, and so the higher your academic results, the more competitive your application will be. Applicants need to have a high proficiency in English language, both written and spoken, and the prerequisite subjects for each of those degrees. As I mentioned, there's some additional important information that you need to be aware of and understand before you make an application, and they are published in the admissions guides. Before you leave here today, make sure that you do have one of these postcards, which will link you to the Study With Us page, Dentistry and Oral Health, on our faculty website. And for those online, you can access them on our website. Now, if we look at the admissions process step by step, first for domestic applicants, in addition to meeting the prerequisite subjects and academic score, you'll also need to register and sit for the UCAT ANZ. You'll need to submit an application via SATAC. Now, lots of people ask about the cut-off for the UCAT. The University of Adelaide doesn't have a UCAT cut-off score. What happens is people will apply for the programs, and then once we have a list of those applicants, and we'll cross-reference them with the UCAT results, rank them from highest to lowest, and invite the top performing applicants to attend an interview. So that varies from year to year, which is why we don't have the UCAT cut-off. So as I mentioned, the highest performing applicants will be invited to attend an interview, and that will be via Zoom. There's one round of interviews which is conducted later in November through December, and offers usually start to commence in the main SATAC offer round once we have everybody's academic results finalised. Offers continue to roll out until all places in the programs are finished, and sometimes that can change depending on people's decision-making process and where they're being made offers. So be patient. That process can be a bit tedious, so just know that offers can be made right up until we start teaching in February, March. For key dates and further information relating to the specific admissions requirements and other entry pathways, refer to the admissions guide. And there is a separate guide for international applicants. So we'll look at that in step by step, but it does follow a very similar process to the domestic application, the domestic applicants, but it just follows a different timeline. So again, the key dates are published in the specific international admissions guide. The key point here is the English language requirements. As I mentioned, applicants do need high proficiency in English language, and the minimum requirement for these degrees is a 7 IELTS or equivalent. The interviews again will be held via Zoom, and people will be invited to attend those interviews based on their UCAT results. Offers generally start commencing shortly after the interview process in October, and offers continually rolling out until all the places are filled.
We're very blessed in Adelaide to have a strong learning environment and culture. Both staff and students are very supportive of everyone reaching a certain standard, and the exciting thing about working in health is that you're always a part of a team.
Now that I'm in second year, I've signed up to become a peer mentor, which means I can interact with first year students to help them feel more comfortable as they transition into uni life.
There's a buddy mentorship program that I've met people through, and when I was in younger years, they'd help support me. It's almost become like my family in a way.
When I was looking for guidance on my subjects in about year 2, I spoke to the support staff in the Helen Mayo building, and they really helped me figure out what was best for me academically, but also for my future careers. It was really good knowing that I'm not alone and I have got support from the actual faculty.
The cohort I went through with are really great. We're a supportive group, we have a Facebook chat, we organise catch-ups, coffee days, and we study together, which I think is really important. Especially coming up to exams, it's great to have that support network and that study framework too.
What I've found from the first day up until this last year is that the lecturers are actually there for us, and they actually really love to help us, and they're always there for any questions.
I was quite nervous moving interstate to study this degree, but I was rest assured within the first week that I was well supported by lots of colleagues and like-minded people, and there was lots of events as well that helped me build some lifelong friendships.
So our aim here at the University of Adelaide is to make the transition into your future study as smooth as it can be. Our Ask Health team are available on campus to help you through anything from enrolment and orientation right up until you graduate. Dedicated support services are available for Aboriginal and Torres Strait Islanders, again to assist you through the application process and also through your time with us. The scholarships team at the University of Adelaide list all available scholarships on their website. We encourage everybody to take some time to view those scholarships and make an application for anything that you think you might be eligible for. We also want your time with us to be a rewarding and life-changing experience on a level other than academic. So getting involved with our student clubs and societies will give you an opportunity to challenge yourself and expand your social connections. With over 100 clubs to choose from across the University of Adelaide, there really is a crowd for everyone. have seen what some of our students get up to when they're not busy studying. I'd now like to introduce you to two of our students here, one from the Bachelor of Dental Surgery and one from the Bachelor of Oral Health. So we've got Yusuf and Peter, if you'd like to join us down the front. And we might just get a brief introduction from you guys about what you're studying, what year level you're in, and a fun fact about yourself.
Hi everyone, my name's Peter. I'm studying oral health and I'm currently in second year. Fun fact about me.
About your studies or something you've learned so far?
I think with oral health, there's a lot of opportunities to work with real patients really early on. I mean, like first year's over and already second year, like from day one, you're working with real patients and being in their treatment plan. So it's really fast paced and yeah, it's lovely.
Hi everyone, my name is Yusuf. I'm in my 5th year of Bachelor of Dental Surgery program. I'm an international student from Canada, and I've already finished a previous degree in with a Bachelor of Science in Canada, and then I came here to study. I picked, one of the reasons I picked dentistry here is what's it called? There was an opening for international students from Canada and abroad to apply, and then the degree was recognized. And I had done pretty much the same thing going to Canada as an international student when I was younger, when I was about 18 years old. So I decided to relive that experience pretty much when I was about 25, and that's how I came to Australia. Yeah.
Thank you. Take a seat and we'll open up to the audiences to see if you've got any questions for our students. Yep, at the back. Yeah, sure. So the question was around how many places are available for both domestic and international students. So there's, for the Bachelor of Dental Surgery, there's 38 domestic places and 36 international places. For the domestic cohort, we also have a rural background entry. So if you've lived beyond the city limits of any major city, I'd encourage you to have a look at the rural background entry pathway to see if you might be eligible, because we do keep 3 places aside for people that meet the criteria. For Bachelor of Oral Health, we've got 32 places with only a couple of places for international. Yep. Question up the back? No? No? Okay, so I'll throw to the panel, and perhaps if you could give us one of your best experiences so far in each of your degrees.
Over the past few years, ever since second year, I've been a part of kind of helping develop some educational resources in the school. One of the things I've noted in dentistry, at least, is that our tutors are quite approachable, and one of the kind of better ways to learn things is to go approach your tutors, talk to your tutors before clinic sessions, after clinic sessions, during lectures. There's always something to discuss, and one of the things I got to do actually was to help develop a learning resource in orthodontics. This was when I was in second year. And that experience actually allowed me to go present my work in a conference in Los Angeles. And this was through the program. So my tutor at the time and my supervisor encouraged me to apply to present that poster, to present that project, and go from there. And now that resource is included as part of the curriculum for BDS4 students learning about orthodontics. So I think that was a very rewarding experience for me.
I think one of the best things about this course is that it's quite a small cohort. I think in my year level there's, I think, 28 people, and like from day one you're spending 9 to 5 every day with them, and it's really good in, especially for clinic placements, that number's halved, so that because there's 2 locations for clinic placements, you're spending even more time with them. And it's good to, you know, study with them, find some social life with that, and really get to be supported through that course.
Any other questions? Yes. Okay, so the question was, is there a pathway from oral health to the Bachelor of Dental Surgery? As Professor Logan explained, they are 2 unique degrees, each leading to different levels of qualification and registration with the Dental Board of Australia. So there's no direct link to either from one to another, and the curriculum is designed to be specific to each of the professions individually. Having said that, there's nothing stopping somebody from doing the Bachelor of Oral Health and then making an application as a higher education applicant for the Bachelor of Dental Surgery, either part-way through the degree or once they complete the degree. And they'll just be considered as a higher education applicant, like somebody would be if they had finished a Bachelor of Sciences or another degree. But we'd use your grade point average for entry for the academic threshold. So they are very closely related, but to standalone degrees. Yeah.
One more question. So for example, if someone does Bachelor of Science and then he for his degree, so is it 38 seats is considering everything, or 38 is only for school level?
So the question was, is there a specific quota for higher education applicants? So the 38 domestic places that I mentioned is the total, and that is divided up into various sub-quotas, if you like, which would be made up of the higher education applicants and the rural background entrants, as I mentioned earlier. Question. So what was your motivation to go into each of your chosen degrees?
I'll start. I think with oral health, a lot of your time will be spending having those discussions with patients, and especially with pediatric patients. You can be the first dental professional to see them from their first dental visit all the way till they're 18. And so you're spending a lot of time working with that and working them and seeing them as they grow up. So I think I have a passion for working with children, and that's why I chose to do oral health.
Thank you.
For myself, after I finished my science degree, I was looking for further education, whether it was a master's degree or going to research or academia. And one of the things I've wanted to do in Canada, it's if you want to do medicine, dentistry, or law, anything like that, you'd have to do a bachelor's degree beforehand. And so I already had something on my mind that's health related. I come from a family where I've had a few dentists in my extended family as well. I spent some time after I graduated shadowing dentists and other health practitioners, and I found dentistry to be quite rewarding, and I've always wanted to do something kind of in the healthcare field, but I also like working with my hands, and I think for me dentistry provides that experience as I get to work a lot with my hands, develop hand skills, and kind of do some detail-oriented work. So everything from doing simple fillings to crown preparations to root canals, there's always a little bit of detail and kind of things like that to pay attention to, and I enjoyed that quite a bit.
Do you guys do any club stuff like out of uni? And then do you guys have
So I myself am part of the Adelaide Uni Swimming Club. I joined the swimming club in second year, and I've been swimming with them since. There's a ton of other sporting clubs in the uni. However, they're kind of separate from dentistry itself. So for me, so dentistry is similar to the Bachelor of Oral Health in that it's a fairly small community. It's a little bit bigger than Bachelor of Oral Health, but it's still quite a small community overall. And sometimes I think, for me at least, having had the uni experience before, I think it's pretty good to kind of mix with people from other degrees. You get exposed to a lot of different backgrounds, and kind of it improves social life as well. And I think joining the swimming club has kind of enabled me to do that. I've met people from many other faculties and disciplines, and I've actually been involved with Adelaide Uni Sports for a few things as well. However, in the Adelaide Dental Student Society, we also have some sporting events for the dental students and BOH students as well.
Just to add on to that, besides the sporting clubs, there's also other clubs to join. I think this year I joined the Sustainability Association, and they do hold events not just for the people in the club, but for anyone who's in the Adelaide University. So yeah, you don't have to be in a club to do those events. There's heaps of events that the Adelaide Union holds.
Question at the back. Experience with rural clinical placements.
Yeah, of course. Actually, I just finished my stint in rural placement in BDS 5, and that was 13 weeks in Mount Gambier. So I was there pretty much from the 18th of January to the 16th of April. 5 days a week, 9 to 5. We get to see patients all day long. It was, for me, an extremely rewarding experience. I learned a lot of things, and I was lucky enough to have several different tutors, some of them who were in the area itself, working in Mount Gambier, the Limestone Coast, or that same SA Dental Clinic, or some of them were fly-in, fly-out tutors, so sometimes to substitute for, if a tutor can't make it or something like that, there's always somebody there. It was great to have several tutors because dentists themselves have, some different experiences with their own patients, different ways of handling different situations and complications. And I learned a lot. My 3 tutors were kind of interested in 3 different things, so I got to kind of develop my skills in those things. It helped me develop my clinical skills, but also my time management skills, so I was able to see more patients, do more treatment, and do better treatment for patients as well. And the fact that it was over 13 weeks actually was a great opportunity because I got to see a lot of patients from start to finish for their entire course of care or treatment plan. Some of those were really complex patients, surgical management, things like that. And yeah, I think that was really rewarding for me as a future practitioner. And I think the feedback that I've heard from the dental students who have finished their placement in different places like Tasmania or Whyalla or Barrie or Port Lincoln, it's always been positive. I think that's a very, very big part of the program.
What are some of the things that were different to what you expected when you first started? Or what do you wish that you had known before you started?
One of the main things, I think, going into dentistry, and I shadowed some dentists, family members and things like that in the past, but one of the things I wasn't entirely aware of is dental anxiety and dental phobia. You don't really know as much about it before, if you're not really involved with the profession or anything like that, but it is very much a real thing, and throughout the program we get taught on, patient management, patient-centered care, but it isn't until you kind of get to the clinic in third year at BDS and fourth and fifth year and so on, and then you get to see the patients, you get to interact with them. And I think for me, sometimes you take it as a chance to change somebody's perspective on dentistry. And this is one of my patients that I saw in Mount Gambier, and she was extremely anxious coming in. She had to, take sedation to even get into the clinic. Once we finished her treatment and she saw me for her last appointment, she even got me a little thank you card saying that, thank you for making my last dental experiences positive ones, because all she's had in the past were negative ones. And it's something that you don't really always know if you're not involved with the profession, but something that you can really make a positive impact on people's lives. Especially for younger patients as well, who may have not had the most positive experience as children and then are coming back now. I think that's something that it can feel quite rewarding when you see them start to come back, not only, not angry to see you or not sad to see you, but also more motivated to take care of their own oral health. I think that's very rewarding.
Yeah, with oral health, you can expect something very similar. Like last Friday, we had a whole day where a majority of our patients were new patients, new young patients who were coming in for the first time. And like just for me, standing back and looking at that, there's a lot of range with people who are really anxious, people who are crying, and then there's other children who actually loved it and loved to play around with the dental instruments. Just something that I didn't realize until I joined until I joined this course, was how fast-paced it is. You're learning one procedure for a week, and then a couple of weeks later, you're doing that to real patients. And so, yeah, there's a lot of professionalism and a lot of motivation that you need before joining this dentistry or oral health.
Okay, I think we'll leave it there, and I'll thank the presenters and panellists as well as the audience here with us today and online. So that concludes the formal session. Our virtual audience can continue to type their questions into the comments section of YouTube. And these presentations will be available to everyone to view online in a couple of weeks. We invite those of you here today to spend some time exploring the building, and in particular the Adelaide Dental Hospital via the tours. Join us in the foyer if you've got any questions following the presentation. For more information on these degrees and any other health-related degrees, you can look at our website health.adelaide.edu, or our university degree finder pages will point you there too.